to you, viewers. Welcome to our very first episode of Nhanga the Podcast, a safe space where we're going to be discussing issues, real issues that impact the lives of women in Bindura, specifically our district, Bindura. We're going to discuss SRHR issues, we're going to discuss HIV and AIDS issues, legal issues, a whole lot of issues that impact the lives of women and children in Bindura. And I am Seppy Ndlovu. I'm a human rights lawyer, and I'm going to be your host for today. I'm going to let my guests introduce themselves to you, starting with Mr. Muzulu, and then we go to Hilary Samuel. Mr. Muzulu, meet the viewers.
Thank you, Seppy. Greetings, viewers. My name is Edgar Muzulu. I work for the National AIDS Council as Provincial Manager for Mashonaland and Central Province. Thank you.
Thank you, Mr. Muzulu. Over to you, Hilary. May you greet the viewers and give them a summary of what you do in the fight against HIV and AIDS.
Okay, thank you so much. My name is Hilary Samuel Ngirazi, and I'm the one of the kids in Bindura district, and we are working under National AIDS Council of Zimbabwe. So we are here to fight against HIV and AIDS in Bindura district, particularly in Zimbabwe.
Thank you very much, Hilary. So today we're going to have a very interesting discussion around HIV and AIDS in the province. I'm sure we have a lot of issues that we have heard through the social media, through newspapers, and today I'm glad to inform you that we have specialists who are going to give us a whole lot of information, including statistics of what's the position of HIV and AIDS in our province. Okay, so Mr. Muzulu, coming over to you, for us to be having this podcast, it was a result of a newspaper headline that came out from our local newspapers, and it was saying Bindura is now a hotspot for HIV and AIDS. On that note, how are you working with the media?
So in terms of working with the media in the fight against HIV and AIDS or in the response to the epidemic, you find that we really need to work closely to have collaborations, and we can do this in a number of ways. The first one is capacity building. We need to take our media people for sort of awareness or information giving sessions where we organize meetings or in the form of workshops, and then we invite experts on HIV and AIDS issues to give media personnel correct information so that they report on the correct information. And number two, we need to give them the correct statistics. And we also, the media people should also ask for responses from authoritative sources. Sometimes some media people unfortunately end up asking information from unverified sources, and at times end up reporting on issues that will become sensational, yet they are not as sensational the way they are. So that can only be overcome through engagement, through validation of facts with the responsible authorities. And as National AIDS Council for 2025, we are strengthening our collaboration with the media. We have planned, we're going to invest in some media tools so that journalists appreciate firsthand implementation of programs at community level. So we plan to have them move around so that they actually mingle with the implementing partners, they mingle with the beneficiaries of the programs themselves, and appreciate for themselves the outcomes that are intended. So if we do that, I am sure we can improve in terms of media reporting, and that can benefit the population, because the media plays a very critical role in terms of information dissemination. And if they do not communicate correct information, it has got some effect. So if these issues are wrongly reported, the problem of stigma and discrimination will continue, because people will be relying on myth, because they have truth and myth, and most people tend to actually like myth. I don't know why. When it comes to these epidemics, people want to look at the negative only. So these collaborations, the capacity building, the closeness of working together, I think can actually improve our reporting, so that we give our population the correct information.
Can you please tell us the statistics of HIV and AIDS in the province, March Central specifically?
Okay, thank you. As you know, thank you, viewers. In Zimbabwe, we are at 1.3 million people living with HIV. That is the estimated figure. And out of the 1.3 million, 1.2 million are on ART, that is on medication that suppresses the HIV virus. Then coming home to National and Central Province, we have a population of 111,000 people living with HIV. And out of this figure, you would find that 6.6% of them are adolescents. This is where Hilary here comes into play, because we have young people, children living with HIV, and these are below 15 years. So 6.6% of the 111,000 people are actually children. Then in terms of the HIV situation, generally, you would find that National and Central is classified as a moderate zone when we compare with other provinces in terms of prevalence and also in terms of new HIV infections. The most hard-hit provinces in the country are Mat South, Mat North, and Bulawayo, then followed by Midlands. So my Central is found in the middle. But coming home, you'd find that Bindura is currently at the top in terms of prevalence, followed by Mazoe, followed by Shanva, and followed then by Mount Darwin, in that order. The list being Gire district, around 36.6%. Then in terms of who is the hardest hit in terms of population groups, we have young people being at the mercy of this epidemic, especially adolescent girls and young women aged between 15 to 19, 20 to 24. That age group, you would find that that is where we are getting more new infections. But the surprising thing is that as we look at men, you find that those above 50 years, 40 above, 45 above, those are the men with the heavier burden, which means there's intergenerational sex taking place, and we think there's evidence that some of these men are actually transmitting to the girls. But then in terms of other districts like Mazoe, we have Mazoe having the largest number of people living with HIV. And in recent years, Mazoe has been at the top. But recently, just the 2023 estimates show that Mazoe is now at number 2. This is courtesy of a cocktail of interventions that have been, implemented within the district as a result of the multi-sectoral response, NAC coordinating with Ministry of Health and other implementing partners coming in so that we do it together. Because the HIV pandemic is not a one-man's game. It needs partnerships, collaborations, and pulling resources together. So it was as a result of this effort that Mazoe is showing signs of, a decrease, which is a success in terms of numbers now getting down, thanks to those interventions. So basically, I can say that is the situation. You would also, viewers may also want to know what is driving HIV in the province. So you find that we have a number of key drivers, including intergenerational sex, We also have gender-based violence, especially what we call sexual gender-based violence, which include rape, forced marriages, teenage pregnancies, and so forth. Those are some of the key drivers that are within our province, as well as some harmful religious and traditional issues that also need some intervention. So basically, I can say in a snapshot, that is what the situation is like.
Okay, thank you very much, Mr. Muzulu. I think that was quite an insightful response. Having mentioned that previously it used to be Mazoe, which was the most hotspot in Marsh Central, and now you're saying it's Bindura. What has changed? What do you think has changed? Why Bindura now?
Yeah, from the periphery, my quick response would be to say nothing has changed except that interventions in Mazoe have worked. In Bindura, the situation has remained almost like a vicious circle where it has been. What we need to do is to scale up interventions in Bindura, to bombard it with interventions the same way Mazoe received help. Was Mazoe enjoyed the interventions such as the Dreams program? Well, this is a heavily funded investment in terms of resources, where there was what we call layering, more than 5 organizations working together, to bring about interventions targeting the same population groups. So it worked because of the intensity of programming. So for Bindura, starting 2025, we were also doing that. The National AIDS Council is actually expanding and in terms of coverage, so that no population group is left behind. Also, no other locations are left behind. Because we know that in Bindura, we have artisanal miners, we have a relatively a good proportion of young people. We have the tertiary institutions like Buse and Zegu. Not that I'm saying these are the bastion of what, but I'm just trying to say this young population needs to be attended to, because it is at high risk of new infections, especially in terms of lack of knowledge, in terms of behavior change, in terms of experimenting. The teenagers and the young men and women, there are a lot of other factors that come into play, like social media, negative to some extent, can also come into play and influence these people or these population groups. So for Bindura, we are going to be targeting key populations. We include the young ladies who have sex. Then we are also going to be continuing to fund the CATS program. The CATS program is very key in terms of making sure that young people living with HIV continue to have viral load, their viral load suppressed, and they continue to encourage each other. I'm sure Hilary will explain more on what is meant by these CATS and what exactly is being done.
So in terms of the key drivers, do these only apply in Marsh Central, or they are only unique to Bindura?
Yeah, some these key drivers are not, they're not homogeneous as such, but they differ from one location to other, from one district to the other, one province to the other. But some of them are cross-cutting. Issues of intergenital sex, issues of GBV, for example. Okay. But there are certain geographical locations where there are no artisanal miners. So the situation there may not be the same as what is in Maso. Maybe it's a farming compound, it may be different from a predominantly mining community.
Now switching over to you, Hilary, I understand you come from Matepa. It's a farming area. What do you think are some of the key drivers causing the spread of HIV and AIDS in your area?
Okay, thank you so much. Yeah, the key drivers in Matepa now is more popular, or it's more highly in miners. Like what I said, some of the people, they migrate for gold mines. So they come in, and after that they behave like people, like nomads. Because why? Vanenge vari vanhu vekuti vanenge vachingoziva kuti ndichangoti nhasi mangwanachi handisipo. So these are the people that causes the increase of HIV, because vanenge vachingoita ma-sleepings around and stuff, so it ended up vanhu vakungoita yese like kunenge kwane vanotengesa like mavendors, so they go and selling goods and their bodies, especially in women, so it leads to the high rate of people that getting HIV positive.
Hilary is bringing in another aspect that is important. He's mentioning of people who are in transit. So maybe just to finish up that question, Mr. Muzulu, in terms of the statistics that you gave us, do you think most of them, they are from the people who are in transit, like the minors, the artisanal minors, and people who just come to march to the province just for work purposes?
Yeah, definitely. That would need maybe a study, a scientific study to really come up with evidence to that effect. But like Hilary mentioned, it is true that we have populations in transit, and this can be within many categories. We can talk of artisanal minors, but we can also talk about even young people, even students in tertiary institutions like earlier on. They're also like nomadic. Okay. This semester they're in Bindura, next semester they're at home. So sometimes we try to give them interventions, but when they leave this place, Bindura, where there are no interventions, they go elsewhere, where they go into different cultures and norms, and there we don't know what then they bring back. So that is a big question to say. How many are they? It may not be possible to say, but to acknowledge that people in transit definitely are at high risk of HIV transmissions, even STIs as well, because of the nature of the way they live.
All right. Thank you very much. You brought up something important as well in your response about students. I understand in Bindura we have 2 universities. Hilary, you are dealing with the kids. Yes. Are you interacting with students to that effect?
Because as for now, we did some awareness campaigns and we encourage them to get tested earlier. Why? Because we know in tertiary schools, we see like some adults, adolescents and young people there. So by the time yavanenge vachisangana, itime yekuti vanhu kuti like vanhu vakuru maona vanenge vakutake advantage of that because vanenge vachishandisa mari. So nyaya inenge yapo. That's why mechinzwa kune inonzi mashuga daddy yatenderera like these days. Yes, of course munhu anenge chida mari, so it ended up like vasikana vakutengesa miri yavo vakuita zvemadhara maona. At the end zvinoita kuti like my young people ave ne high rate yekuti ivo ndo vanenge vakubatwa HIV positive because vanenge vane sort of like akurwidzana, because we don't know kuti anenge aine vangani like vasikana vanenge vachitinde vake iye ari munhu wake. So it ended up vanhu vave kuti at the end vanenge more infected maona. It's because of money. So in tertiaries like pane pichitodiwa serious yekuti paitwe like ma-condom distribution like what we did last month. Takaenda kubhuse tikanosiya ma-condoms tikaenda kuzego fuichi kuzego kuchiri nenyaya yekuti they don't tolerate, so takangosiya ma-clinics ari padhuze. So that I think zvichatibatsira isusu kuti tigova something chiri tangible or result riri nani, because in tertiary we know kuti ndo kunowanzouya like ma-STIs. Like now tine ainumber yevana vari in tertiary vari kubatwa vaine ma-STIs. So it ended up tisingachazive kuti like inenge iri syphilis chete here kana what. So tinenge ta kuti vakurudzira kuti vatestwe, and then kana paine anenge aita positive like timacase takuita follow up kuti initiate.
Okay, so Hilary, you mentioned something about initiating students who are HIV positive. How do you go about it?
Okay, thank you so much for your question. Yeah, if tabata munhu kuti ari HIV positive and eating, as a kids, we should refer to the clinic, and we follow up. Why? Because the sum of anokudza kuti ndakaenda handiti, but iye asina kudi kutoenda kufacility kwacho, and then kana tione access yekuti totoenda naye kana akabvuma tinotoenda tese, and then tosvika to make sure kuti ainitiatwa, and then tinenge tichimita ma-follow ups weekly kuti tigone kuona kuti ari kunwa sei mishonga yake handiti, because we know kuti like kumatisharies vanhu vekuti vanosangana nezvinhu zvakawanda, sometimes anogona kutoaffectika even nyangwe nestigma chaichaiyo, because tine mastigma too yekuti anostigmatizwa nevamwe kozoti atinoti self stigma. So zvinhu tu izvozvo zvekuti tinenge takunofokasa nazvo kuti tigone kuona kuti hazvisi kumukanganisa here, nekuti zvikangomukanganisa even nyangwe needucation yake inobva yaita low.
Thank you very much. And then still on that note, I understand yourself, you are a cat.
Yes.
What have you been doing to impact the community you live in to reduce the spread of HIV and AIDS?
Okay, thank you so much for your question. Yeah, it's so difficult as a cat. Why? Because vanhu vazhinji havazvinzwisise, ende kuti unzwamira pamberi pevanhu vanenge vakuda kutanga vanzwa kuti iwewo who are you. So as for me hangu ndakasvipira, and I introduce myself firstly, and most of them they know kuti I'm HIV positive. And by the time inoitwa ma-community workshops and stuff pepe ndinotoenda like ndosvika ndotaura nevama-caregivers first, and then ndo vanozondipa ma-village heads like ma-plot holders ndo vanotozonzoti ano musi wakati uya kwakati umbosangana nevechidiki. And the big challenge yatiri kuona ekuzokonzera kuti tive ne-more infected kuma-young peoples inyaya yema-drugs.
Okay.
Because if munhu watra ma-drugs influence yekuti uite zvese zvese inenge yavo. Why? Because unenge usina self control, and we see kuti ma-drugs haachangotorwa nevakomana chete, even girls, because of vanenge vasingachaendi kumaschools vamwe vacho maona, and nyaya yemaschools kuvasikana vanongoti hazvina basa nenyaya yema-different cultures kuma-farms kwatiri. Like paissue yema-drugs in Bindura, it's a big issue. Why? Because normally ma-drugs anoya munomo like nezvatambotama artisanal minors, even kuma-tertiaries ndokwaanonyanyobata ikoko. And tine ma-drugs like ratendera kunoko pane rinodedzwa kunzi skange maona, zvinhu zvekuti kuma-young peoples handiti like vanorama neutachiona hwe-HIV zviri more affected. Why? Because tikatarisa munhu kana washandisa drug unogona kutoita kana challenge yekukanganwa, and then kana wakanganwa hauchakwanisi kudzoka kumba in time kuti ubate adherence time yako yekutora mushonga. So zvinolida izvo nekuti futi munhu yeye kana into drugs strict pakucontrola. Why? Because munhu yakuti anenge akufila kuti iye ndiye maona, and at the end anopesa akuita hunhu yavo kuti like ndo pamunozonzwa ma-issue of rape, because munhu anenge akadhakwa maona, kuti azorealize kuti nezuro ndakarepa munhu kana kuti ndakarepewa. It's so difficult kuti tizoita trace out, and at the end tinoona kuti ndo futi panogona kunge pachizospreadwa futi HIV. Why? Because munhu kana asingachatora mishonga yake aconcentrate nema-drugs handiti viral load inova high. Kana yava high anenge ane high chance yekuto explode to someone if akangoita sex chete asina protection. It ended up munhu iye atova HIV positive. So issue ma-drug is for Bindura district now tikutombotrya kuti timboedza kuita ma-awareness campaigns, tichitopinda even nyangu ma-community chaimo kuti tigone kuona kuti ndipapi pari kulika kana kuti ndezvipi zvatingakwanisa kuita. For example, kumbotaura nema-village heads, ma-farm holders maona, kuti vagone kuva strict kuti like panoitwa panovhurwa ma-shops and tech shops pepe vagone kunge vachiita strict kuti vaone kuti hapasi kuiswa drugs rekavati rimwe doro risiri necessary because kune like ririko mazuva ano vanhu vanongoridedza twakasiyana-siyana, vamwe vanoti tumbwa, vamwe voti tumusombo, zvinhu zviya zvekuti even nyangwe kanyanzi hausi pamushonga basically zvinotouraya system yemunhu. So zvinopedzisa zvane haichanzi yekuti munhu unenge usina immune system yakasimba, and then anything chinenge changoita infected kwauri unotorwara. So issue yemadrug I think panofanira kutomboitwa serious, nekuti tikatarisa ndo zvinhu zviri kunyanyobata vechidiki, ende tikatarisa futi ndo zvinhu zviri kuita kuti vechidiki vatadze kunge vari vanhu vari concerned nelife yavo, zvekuti ramangwana hatombozive kuti richabva kupi richienda kupi. So issue yemadrug iri serious in tertiaries, because vamwe vana chaivo vanenge vakutosika vanzi madrug dealer vari pachikoro, like yatakamboita kubhusoko tikazongorifewa nyaya yacho kazenge ane macid mukati, I don't know kuti yakazopera sei, but munhu wekuti anenge akutosika konzi ningi ukaenda anosvika unokupa kana guka kana chii zvimastones zviya zvamawana, like sei ainzi anodhilivhera zvinhu zvakawanda. So luku kuti pachikoro pazviri kuitika handiti, and pane vana hapana kana like guide nekuti anozoona kuti mwana aita sei, whether musikana kana kuti mukomana, munhu wekuti anenge aine freedom yekuita zvaanoda handiti, and vazhinji vacho vanenge vachizviita vanhu vakuru. So it ended up murisk yekuti vanoita HIV, ma-STIs, maona at the end zvinopedzisa zvakuita kuti ivo pachezvavo vamwe vacho vatadze kupedza chikoro in terms of stigma, and vamwe vacho vanogona kutorwara kutozosvika paextend yekuti anozoiswa kuchipatara atova munhu yakuti anenge atova pacritical, maona. So ndo imwe issue yekuti madrugs anenge akukonzesa zvinhu zvakawanda, like kana ari pamushonga umwe wacho unotozonzwa kuti ane kana kuti 6 months asingauye kucollecta mishonga yake.
Thank you so much. Maybe on stigma, previously you mentioned that you're working with students as well. What are you doing to sensitize them against stigma and discrimination?
Okay, thank you so much. Like pa stigma, normally vanhu vanostigmatizwa ivo pachezvavo nekuda kwekuti vanenge vaita yatinoti disclosure handiti. So isusu tinotogara taemphasize kuti una someone wanoda kuita tell us your status kuti you are HIV positive, maona, and then iye akati yes, tinomukurudzira, because the reason why tichimukurudzira pakazoitika anything kana kuti like munhu arwara kana kuti afenda chichi anogona kupiwa imwe mishonga handiti, maybe madrugs like ma-ARVs aita kuti adi afende, ndino kuti anoita kuti munoreact like ma-first days paunoinitiate, umwe munhu anogona kungonzwa dzungu, umwe anoita ma-skin rashes. So tinenge tichiitira kuti like pakanzi paitika kesi yekuti adonha aita sei handiti, paina someone kuti anokumudza kuziva kuti no, munhu akataura kuti ane issue iyi handiti. But after that akazoona kuti those people vatinenge tichiti vachaita confidentiality nestatus yake kana kuti nestatus yemunhu ari HIV positive ndo the same people futi vanotanga kuspread information. So it ended up munhu akuzostigmatize zvekuti haanetsi kubuditsa mune vamwe, and munhu anenge ane stigma unotonyatsoona kuti like sometimes anenge ane mental problem, anenge akutoda kutoscreenwa futi mental health, maona. So it ended up zvave difficult kwaari iye kuti agone kusolve. So isusu we encourage iye kuti agone kuzvigamuchira iye pari ave yatinoti self esteem yaye, ave neramangwana rekuti anenge aine hope mariri. I'm one of the people wakambosangana neissue yoyo, like ndiri grade 5 inini yangu yato self stigma because handina kukwanisa kudiscloserwa from my guardians kunzi I'm living with HIV, but you know kuti munhu echikura nebrains dzinenge dzichikura, so ndakazongozvidiscover ndega after taita malessons echikoro, and then after that ndakatanga kustigmatize, and then after that one of the sibling wandaigara naye wandaitobva naye kumba, like munongoziva kuti muri vana munogona kunetsana, akabva azvitaura zvazvo kuti mune michitukana zvazvo zvekuti anonwa mapirizi mona. So it ended up ndamunhu wakuti pane vanhu ndenge ndichingofila out of place, ndenge ndingori lonely, ndichigara pangu ndega maona. In fact panyaya dzechikoro ndanga ndatova low mona, and zvakalida kusvika paextend yekuti ndakanga ndamunhu iyoyo kuti anenge aviolent, because unenge wakungoona kunga like uri lifeless, unga munhu angori useless, hapana chauchabatsira. So ndozvinhu zvekuti ndinenge ndakuenda paari ndinosvika ndodiscussa naye kuti kuti sometimes ukaita zvinhu izvi like violence unogona kuzorova munhu uine hasha, of which unenge uchiona kunga like atadza sei, but yenyaya yekuti unenge uine mental inenge yakakanganidzika mona. So zvinenge zvakureva izvo nekuti iye akazviunderstanda kuti stigma is not good, anogona kuti even nyangwe akanyataudza ningi anoita zvakati, unoonedza kuti it's not a problem because inini ndini iye ndiye. And zvinobatsira izvo zvomukazviona kuti if ukangozviappreciata iwo pachizvo ukangova neself esteem yekuti inini ndini, unorarama life yako isiri yekukombea kuti like ningi dai panga pasina ningi izvozvi ndiro HIV negative. Like ndopa example, kuno mumwe wandakambosangana ichiti inini like ndaivenga vabereki kuti ndo vakandipa HIV positive, but takazomonesa tikati it was not a fault yavo kuti vange iwo unge uri HIV positive, because tikatarisa hakuna munhu anoda, and it's not a choice yekuti unoti hai ndazvipira hangu mona, but chinenge chapo ndechekuti appreciate zviripo izvozvo, and then you can go on life yako. Ndozvinhu zvekuti tinenge chakubata maareas ekuti angaita sei kuti aite chikero nelife, because tikatarisa kuva HIV positive doesn't mean kuti you even do anything. You can do whatever you want. Unenge uine access yekuenda kuchikoro kuita sei, but ukazvistigmatize iwewe unenge wane issue kuti unogona kutosiyira chikoro chechipanzira. So ndo paareas atinoita kutambira kuti agone kunge ari esteem yekuti agone kufocusa, agone kukontinua nechikoro iye pachezvake, and then it ended up munhu akuziva kuti alright kandi HIV positive ndezvipi zvandotarisa kuita.
Maybe there's someone out there listening and maybe they are in the same predicament as you. What advice do you have for them? What really made you conquer that stigma and discrimination? Maybe just in short and brief.
Okay, yeah, stigma is not good, and like to people that are not living with HIV, don't stigmatize HIV positive, because you never know about tomorrow. So unogona ngofuma uri HIV positive iwewe and waimbo insult mumwe munhu kana kuti like waita yatinoti deformation of character yekuti unenge uchimudefomata pane vanhu. So at the end ukangozvifunga kuti dai ungori iwewe unoita sei, even nyangwe kune ivo vacho vari infected like vanova vane HIV positive, stigma is not good, because ukazvistigmatize ukaita mental problem handiti uchakanganwa kutora mishonga yacho futi iwewe pachezvako. So inenge yakutokukanganisa iwewe pachezvako kuti ukazvistigmatize, one uchava nehigh viral load, and it ended up wakurwara futi kuti like ukazongoita any sex and protected sex mukana wekuti ubatire even nyama STIs, even nyamwe chero zvimwe zvirwere ma-TB and stuff, zvinhu zvokuti zvinenge zvakuya because the immune system inenge yaweak. So stigma zvinhu zvokuti once wangonzi uri HIV positive, I think you should accept your status as you are, and then you can go on with your life, and also because that's a new life. To be HIV positive, it's a new life. Kana ndakazvitarisa. Why? Because unenge wa munhu akurarama uri belong to something handiti. So by that unofana kutova strictly pane zvinhu zvanenge uchiita, like kutora mishonga ukadefaulta, it ended up like kana wangu wachizvivanza kuti you are HIV positive, vanhu vese vanotongozviziva kuti wa HIV positive. Why? Because tikatarisa pamba inogona kuzoita maskin disease zvokuti vanhu vanotozomentiona like yaitika kumashure kulomubheki yatingangonzota ndichivadi kuti anzi waigona kuona bvudzi richierera like maskin disease zvokuti unongoitanga like munhu ari kubuda like rust, so hameno zvazvingori. So maona zvinhu izvo zvekuti at the end vanhu vanenge vakukwanisa kukunongedzera uri kuri kuti ukuona ningi tasaone, ende vanenge kuti hazvibvunzwe One. So ukazvistigmatize unenge uchizvisa pariski iwewe yekuti unopesa wakutozvishambadza futi nerimwe side kutozvipublisha wega. So stigma is not good at all. And even nyange kune vanhu vari HIV positive, don't stigmatize vanhu vari HIV positive, because ndivo vanhu oro ndimi vanhu munokwanisa kunge mechitosimudzira kutovapa courage yekuti vagone kuona vision yamangwana kuti ndiro access yekuita kana lawyer, access yekuita kana doctor. Maona manje tikatanga kustigmatize it ended up munhu alose hope.
The discussion is getting very exciting. We are hearing new things. We are learning a lot. But unfortunately, guys, I have to interject. We've come to the end of our time. We cannot continue with the discussion. From us, we have come to the end of our program.